So we at Duality are really around solving this kind of conflict that was raised before between the collaboration side that we all discussed and the privacy and confidentiality side of it. And if we look at this world, we all know that real world evidence is as good as the data, the real world data that we have to analyze. And we've discussed here, and from multiple people, we heard about the need to combine data from multiple sources, to enrich data, but also to work between the entities that have data and entities that want to analyze it and drive all these things. And we spoke about, or there were questions in the chat around how long will it take until we get there and what are the barriers? One of the barriers is clearly the side of privacy or data protection or confidentiality, but also entities that own data that are not willing to share it because of various types of business challenges and business concerns. And Duality's mission in life is to bridge these two things, to enable companies, specifically in real world data, to aggregate data, combine data, link data, derive insights out of it without running into these challenges of privacy and security. And a quick snapshot of Duality, the way we do it is that we've built a platform that enables our customers to basically analyze data, derive insights, without ever the need to share the actual raw data. It may sound a little cryptic, but it's based on very advanced cryptography technologies that essentially allow you to analyze the data while it's encrypted. For example, let's say you take two medical centers that want to jointly analyze data. It's equivalent basically that each of these entities take their data, lock it up in a box, in a safe, ship over the box, the locked box to their partner without ever the key. So the partner can never see the data there, but can derive the insights. So for example, if you're trying to identify correlation between some drug treatment and the outcomes, or to optimize a dose of a drug or something, all what you need is the output of the analysis. You don't necessarily have to see the raw data, and that's what we provide. The company is based on very advanced technology called homomorphic encryption that our co-founders have invented and world leaders in the space, including Professor Shafi Golvasser, that actually is a Turing Award in the space. And we mainly cater to customers in the financial and healthcare world. And I think there's a lot to learn from the financial world in terms of the regulators, how they enable and enforce the sharing that we can take into healthcare as well. But to be a little bit more concrete on what we offer in real world evidence scenarios, we enable our customers to do 4 different types of collaboration models, which are all around bringing data to data and enriching it, or bringing data to models, or querying data sets, all in a confidential way, and allowing things like better risk assessment, real world evidence data, combining these together. And I encourage you, I won't have too much time because of the delay here to go into use cases, but please reach out to us and go through our website and see what we offer in the space. I want to focus specifically today on multiple center real world data analysis, which I think a lot of the talk spoke about the need to combine data, and we call this combining or data linkage, where you combine data on a patient level, for example, genomic data to clinical data, to claims data, to wearable data, all of this on individual level, or simply time to market in some sense, the ability to aggregate data sets from multiple centers to have a larger cohort. And that's what we enable. Classical ways of de-identification today or dealing with the privacy do not work in this case. If you want to link, you have to link on an individual level. So if you delete all the private information, you cannot do it. In many cases, you have to, de-identification methods add noise to the data and you want accurate results. So the solution Duality brings to the market is actually enabling all the different entities to encrypt their data, send them to a central entity that can analyze it while it's encrypted without ever opening it, derive these outcomes, allow better benchmarking, allow better drug effectiveness measurements, allows to see insights, all of these things without ever having the actual raw data exposed. And just as a summary, one of our case studies that we publicly can present is something that we've done with the Sourasky Medical Center in Israel, which is exactly taking a data set of cancer patients and linking it and combining it from multiple sources and showing different ways of survival analysis applied to this data. And one of the questions in the chat was, when will this become a reality? So these are the things that are already working today, and we're driving and offering to our customers, showing that this type of analysis, while the data is protected, can be done without ever exposing the data, but still providing fully accurate results.